Hello friends, welcome to another episode of Aware and Care with your favorite doctor, Dr. Ambika Nair, who's the co-founder and chief consultant at Shantigram Group of Companies. Shantigram Group of Companies, of course, you know by now that the doctor always recommends herbal remedies, and the body has a natural healing system. They help to activate that system and so that you can heal naturally. Let's welcome Dr. Nair to the show. Namaskaram, doctor.
Namaskaram.
Dr. Nair, nature, we have been born with certain beautiful body organs, eyes, ears, nose, hands, legs, and of course, the most important part of our body is also the mouth, the tongue. There are so many quotes, idioms talking about the importance of the tongue and how controlled it should be, whether it's speech or whether it is food. But yet, sometimes it happens as we age or due to certain conditions of the body, the tongue gets a beating, a big beating. There is swelling on the tongue. The sensation of the tongue is not there. There are bumps on the tongue. And actually, we do not actually know what is the true color of the tongue, whether it's pink, whether it's white, or whether it's pink. Now, there is a condition we have often heard. It's called glossitis. Can you please explain what the condition is?
Okay. Actually, it's an inflammation of the tongue.
Mm-hmm.
Can be acute, can be chronic, and different types will be there. How it happened, that is more important.
Mm-hmm.
Okay. Acutely, that the people will be telling they went for a party.
Mm-hmm.
So, after eating certain food, they would tell that just after eating, they felt like something is pierced, in their tongue.
Yeah.
So
okay.
So they will tell that I could not, it was so much of burning. I felt as if everything I am fuming. So I could not even, the water was trembling, saliva will be trembling actually. So they just come out, they don't know what to do. They'll be keeping ice on their tongue. They will be doing so many things. Sometimes it goes like, that is an acute thing.
Mm-hmm.
So, because actually often develops suddenly.
Mm-hmm.
And can have a severe symptom also because it's a really very severe, they have to rush.
It could be temporary also, right? Acute.
Acute means it can be because of any allergic reaction, any food reaction, any injury, whether they have bitten their tongue or something like that, something like unknowingly, you understand? No? So that it goes, that is called acute actually.
And
Chronic, it can be any inflammation of the tongue that actually underlying situations will be there, like diseases, whether it is even, like a cancer can be, lymphoma can be, or any other ulcerative colitis patients also, they will complain, their tongue will be very reddish and all. That's in Ayurveda. What we do, we always do the tongue diagnosis.
That's right. Okay. You always ask the patients to open their mouth and show their tongue.
Now they wear the mask and come. Now, please, can I? No, I told because I need to see your tongue. It's really interesting also sometimes.
That's
and like otherwise some candida or any yeast infection, like a type of glossite is also there. That can be, like a median or rhomboid. Atrophic glossitis are also there. You can see bumps on their tongue. This is all, how you differentiate the diagnosis and how you diagnose the cases.
Yeah. So you just mentioned there could be a piercing pain or a sensation feeling. What are the other symptoms for somebody to know that this is
heaviness? They cannot talk. It becomes so heavy, as if they cannot even. Sometimes it become like numb. They can't even take it inside. You understand? No. Like this, so many times it happens.
Anesthesia feeling, there's no sensation there.
No pain. The tongue will be change in the texture will be there in sudden, like size of the, even shape, because it becomes so swollen. Okay, different colors. Okay, like on the surface you can see loss of ability to speak or eat properly, difficulty in swallowing. Some people will have a lot of breathlessness because we are seeing only the tongue. Sometimes it will be swollen inside also.
Near the tonsil side. Okay, so there is danger to life, right? If there's no sensation
of course.
Oh, so this could be life-threatening, friends. So today we're talking about glossitis, a condition of the tongue where there is sometimes swelling, lack of sensation, pain when you eat certain foods, or it could be temporary, it could be long-term, and it could also be cancerous. There are three aspects to it, but today we'll understand more about this condition, as it whether it's genetic or it's allergic or it's something to do with muscle. What is it, doctor?
No, the causes can be, like it can be because of some people will be very anemic. So that is also one of the reasons for that actually. Even nutritional deficiencies will be there. Let's say, allergic reaction can be there, injury can be there, some underlying diseases can be there, like deficiencies, not only, B12 deficiencies, B6, B3, all those things, some infections, viral, fungal, or some even drugs. If they take some drugs, drug inflammation also, that reaction can be there. Yeast infections can be there. These all can cause glossitis actually.
Okay. What about long-term use of betel nut or tobacco or
that is different actually, because that is they are knowingly doing it.
So, but it can happen
yeah,
because
of course it can.
Okay.
Because because whatever they are using, something, like any changes in that, sometimes it can happen. Betel leaf also, even smokers also, you can see consuming of any other things like that, that can be, that can happen.
Yeah, any kind of addiction also could create this problem.
Definitely. And very, it is mostly seen in people with so much of spice. So be careful.
So, Dr. Naik,
Okay.
what exactly should be the color of a regular tongue?
You show your tongue, I will tell you.
No, not
so that should be, like pinkish.
Pinkish. Okay.
And
Now,
very nice papillae will be there. Like see, like even white coated means it shows that there's an inflammation in the liver. Like whether you have constipation, whether you are having even like very high, like infection, everything we will be able to diagnose through the tongue actually.
what an amazing organ, and its functions are so beautiful. We're talking and eating and taste. Does the taste buds get affected when this condition comes in, or people?
Yeah, when it is like atrophic, because actually it will become like so irregular shape. Actually, I have a lot of like like people coming to me for all those things actually. Okay, so like atrophic glossitis, or it is called Hunde's glossitis. Like tongue, like small bumps will be there. The papillae will shrink, changes the surface of the tongue, and making it appear very glossy. You can see when you see very close, because it's all like gone almost. Yeah. So they don't feel the taste also. Yeah.
That the swelling, that glossiness comes because of the swelling?
Swelling. Yeah, no, because of the glossiness comes because actually the papillae, everything, because it shrinks and become like bump.
Okay.
So it is like, what do you call? Thickness is there.
It becomes like leather things.
Leather tape, like that. That's why it is little glossy. We can make out, any diseases. See, like whether like any other inflammations, we will be, whether it is marked tongue will be there, whether it is fissured tongue. So many tongue diagnoses we do actually.
Most embarrassing part of any doctor's appointment is when the doctor asks us to open our mouth and show our tongue. We're like, oh, I just ate something, or I didn't brush my teeth properly. Now let's also talk about oral hygiene here, because I do hear a lot, especially in school-going kids today, that traditionally we give a lot of importance to tongue cleaning in the morning after brushing, but we hear a lot of children these days not using tongue cleaner once a month or something. Does this also create a developed stage of glossitis, or it is just a hygiene condition?
See, it is oral hygiene is more important. Actually, the mother is the best one who will be teaching the children, how to do the oral care. Okay. So, see, in Ayurveda, what we practice is a dinacharya. The morning you get up, brush your teeth, scrape your tongue, so that, all the toxins will be out. Sometimes, even scraping the tongue, don't think that because all the toxins will go away. So people will tell that, doctor, I did not scrape the tongue today. I told it's not a must that, because actually we know I just ate it. So it will be there, like, what color it will be, yellow color, grayish color, blackish color, tongue, like how it will look. So it all according to the diseases. So we tell them, like to do the brushing in the morning and especially even after eating at night, before going to bed, then we advise them to do the oil pulling so that they don't fall sick. Teeth will be good, tongue will be good, their oral hygiene will be taken care.
I'm going to start oil pulling today. I keep promising myself every time I see you. Today I'm going to start oil pulling.
We have very good Arimedadi, oil which will help you for that.
Okay, great. So Dr. Nair, you just mentioned about children coming to the appointment, and whatever food that they are eating just before coming for a doctor's appointment also could affect the color of the skin. But as a specialist and somebody who is so learned about this subject, viewers, you don't have to be too hesitant if your tongue is not very clean at that point. Maybe you've eaten a colored ice cream or a cake and your tongue is blue or orange or green, but the doctor knows best by looking at it whether it is whatever is the internal condition. Now, we've understood the symptoms in so much detail today about glossitis. Now, let's also understand can this be hereditary or it is just comes with
but that is very less, some liver cases, it can be hereditary.
Oh my God.
Okay. Otherwise, like you see, when they see all this atrophic or any chronic, see if it comes and goes once in a blue moon, that's fine. But if it is there for a long time, they will take the biopsy and see whether it is to rule out the cancer actually.
Tongue biopsy?
Yeah. They will do, so many people will come, they will take, like very little. So then they will do it and they will confirm whether what disease, whether they are on the danger zone or anything like that.
And what is the treatment for this? Is it curable? Or
treatment, of course, it is. You see, if it is like acute, and we have to treat for the root cause actually.
And what kind of dose?
Yeah. So, why they are like this, that underlying factor which led to glossitis has to be taken care. That is more important.
Okay.
Okay. So, lifestyle changes, diet changes, too much using of spices, especially, like this like red chili powder, any chili, like a cayenne pepper, all those things, some people it will not work for them properly. So it can, like any reaction. So that has to be ruled out. And the diet, we will tell them to take only cooked food, very, very light food, which will make them healthy, which will digest and assimilate so that they won't fall sick. Eat, like iron containing vegetables, like green leafy vegetables, pomegranate, all those things we tell them. Pumpkins.
Okay, this is
we have lot of like squash, everything that is all available, like the only thing we should use it, that's all.
So everything goes through the mouth, and this is food is such a main part for healing the tongue here. Now I'm trying to understand, how does a treatment process goes? Like, do you do panchakarma for this also, or
if needed? Yeah, sometimes in kapha related means like so much of mucus, also post-nasal dripping, even acid reflux actually, hyperacidity, so severe constipation, so that becomes like a little chronic.
Okay.
So if the person is like a continuing for like on and off, they will tell like I get mouth ulcers. Oh, it always comes once in 15 days, doctor. So there is a reason. No, I have gone to so many doctors, but they could not do anything. Of course, diagnosis is more important. Where is the root cause? So if you find out, we tell them, like go like this, they are fine.
Now, you mentioned so many foods here. Of course, we have to have our daily food. When the tongue is so swollen and painful, how does the patient actually make that effort to start taking this?
They cannot even swallow at that time. That's why at that time, when they cannot swallow, they will be admitted.
Oh my goodness. Okay, that I understand.
Understand. So that will be in acute cases. Yeah.
So we're talking today about glossitis, a condition of the tongue. Many a times it is temporary, it's acute, sometimes it's chronic. And at some points it can also be cancerous if it is not cured or if it's not addressed to at an earlier stage. And doctors also mentioned about reasons behind why you get this. And today now at this point, we're talking about the treatment options for glossitis. Now, doctor, what is the remedy to reduce the pain, or are there ointments that are applied on the tongue or oral medications are given? And
so glycerin can be applied at that time. So it has a nice hygroscopic action, so that it will help a lot actually. Okay, so to reduce the swelling, we use honey
Mhm.
There are so many medications also in herbal herbs also available. According to the condition, we give them actually.
Now, very
Yeah.
important question I feel here is a person with a swollen tongue, when he or she or the child is sleeping, it is one of the most crucial point of the day, because there is no sensation. The tongue could roll back and the person would not be able to know how to
Side lying.
side sleeping.
Never like that.
Never falling stay on the back.
Yeah. Otherwise, the tongue will fall. You know that it will obstruct the breathing actually.
So is it possible that somebody doesn't know that they have glossitis temporary acute?
Oh, everybody will know, because actually when the
No,
tongue
during sleep that, you know, they are
no, that is in epilepsy patients. Never in this case.
never in this
Never,
case.
never, never,
Ruled out this condition. not-
never, never, never.
Okay, that's a relief
Yeah,
to know.
yeah.
So we are saying that when you're sleeping,
Not that dangerous.
not that it is. So somebody who has glossitis, they are recommended to sleep on the sides, not on the back, so that the breathing is not obstructed at night. Now, what are the other treatment options at Shantigram when somebody comes with glossitis? Please continue.
Yeah, we do treat for the root cause.
Mhm.
Pulse analysis, nadi pariksha,
Mhm.
and we listen to the. So many people will tell Dr. Ambika doesn't listen. No, it's not right actually. Actually, I always listen. First, I do the nadi pariksha, then I will be listening. Then only I see their reports and all.
Mhm.
Because like any Ayurvedic doctor who knows the nadi pariksha, first they will see
Mhm.
how they are. Then they will tell, oh, come on, go ahead.
Yeah.
Okay. Then only we, yeah.
Yeah, friends, that's a very important point Dr. Nair had just mentioned. An experienced eye does not need too much of research into the subject. They have one look at you, and that is exactly the beauty of Ayurveda. They are not asking for blood reports and these tests and those tests. Nadi pariksha, or the tongue examination, or looking at your face and eyes, they're able to tell you as to what is happening inside the body. And that is exactly what Ayurveda is. It is not too intrusive and, making you uncomfortable. But it's just a matter of 15 to 20 days when you start seeing the response to the medicines, and then you go to the next stage.
Why
Yes,
15, 20 days? They will see within 2-3 days.
2-3 days. Okay. That comes us from the horse's mouth, and today we are talking about glossitis. Dr. Nair, we're talking about the treatment options for patients with glossitis. Please.
Yeah, that like detoxification is needed, if needed.
Okay.
Okay, so Panchakarma is okay if that's what I told you. Which Panchakarma has to be given, it all depends upon the condition. Okay, sometimes Panchakarma is not needed also. Only with the herbal supplements, we will be able to take care of them. When we cannot do it, then we advise them for Panchakarma, especially for glossitis.
Okay. Now,
any underlying inflammation means, then definitely I will advise them for Panchakarma.
Panchakarma, okay. Now, what underlying cause could also lead? Is there any specific disease that gives this as a symptom? And people with glossitis also could be losing a lot of weight, right? Because they're unable to eat.
Yeah, they will be so many, they especially in ulcerative colitis and all, I have seen that they cannot eat too much fish aid and very difficult. That's why they are always taking steroids. Yeah.
Ulcerative colitis also is possible here. Okay, Dr. Nair, as we're talking about glossitis, what is the kind of tongue exercise or any kind of temporary relief that can come apart from honey? Can they do gargling or salt gargling? Does it help?
No, salt gargling, they will jump. It will pain like anything. It will be so painful. Okay. Only with the honey they should do, or with the glycerin they can do it.
Glycerin also.
Yeah, keeping, like a oil pulling, they can keep it with that there. Like a honey and little water, then they can keep on going. It will help a lot actually.
And when it comes to oral hygiene, apart from brushing, when they have this condition, is tongue scraping recommended, or light version of it?
No, they won't be able to do tongue scraping and all, because actually it will be very painful at that time. See how much severe the case is, Madhavi.
That depends on that. Okay.
You understand? Sometimes you won't be able to touch even. It will be like too much of fud, because the inflammation is very high at that time. If it is acute, means you cannot tell them, because they can't even, they are like running for their life. You can't ask them to do, like a tongue scraping or anything like that. They won't be able to.
How is oral hygiene taken care of in such a condition? What kind of rinses are required? Because you want to keep it clean and avoid the smell also, right?
Yeah, that, turmeric can be used there.
Yes.
It's a very good, actually. Glycerin and the turmeric is very good.
Mm-hmm. That's
Yashti Madhu is very good. Yashti Madhu is very good because it helps a lot, actually. Okay. But
Now-
acute, how you take care? Nobody will come to Ayurveda until they try to manage it. Okay. When it becomes chronically, they come.
that is
So the
also-
line of treatment is entirely different. So we will find out what is the underlying cause.
Mhm.
So where they went wrong.
Okay. In some situations, despite you suggesting so many beautiful, healthy, very in the kitchen options, is there a possibility that glossitis can go away on its own? Or
If it is a chronic, like a constipation, means they can take castor oil every day, 1 tablespoon.
there it comes. Okay, castor oil.
Yeah,
It's been a long
that is
time.
very good. And using, turmeric,
Mhm.
not like a 1 tablespoon, 2 tablespoon and all. Okay, like a pinch of turmeric, you can use it for gargling.
Mhm.
That will help a lot, actually.
Well, now, in the middle of the program, you did mention about iron deficiency and B12 deficiency. So these kind of tests are very important to know what kind of deficiency is there, and they can use those things.
Burning sensation will be there, no? So
Got
we
it.
know that how it is actually.
Mhm.
They will come with the reports only, don't worry.
And how long does glossitis last, or what is the course of treatment when the person starts feeling comfortable?
If it is acute, means it should be subsided within 72 hours.
Wow, 72 hours, and then the magic of the medicine starts working, and you can start leading a normal life. Thank you so much, Dr. Nair, about today's episode on glossitis. Anything important that I have missed on asking, please do mention here at this segment.
See, our digestive system, that has to be taken care.
Mm-hmm.
Okay, don't go for, like too much spicy, very cold food, very hot food, getting injury, or sometimes, like children will go and, do at the back of the insects and all, like insect bites or anything like that, So anything can be, like especially now this is summer, and they eat anything wrong, some fruits not washed. So any inflammation is there, we get like people go for all this, like apple picking, all those picking, like so if they don't take care like properly, means anything can happen, if they eat over there or something like that. I have a patient recently, like a strawberry picking, they have gone there, and from there she got an inflammation like this.
Because the pesticides.
Yeah, because I don't know whether it was pesticide. They told it was very good, but it was not that great. Actually, she had a very, very bad situation, but now she's perfect.
So very important aspect here we have come talking about glossitis is that when you're eating raw foods, it has to be washed properly. And most importantly, cooked food is the biggest remedy here. But I think we all fall through temptations, and the tongue plays a very important role for that. So if you're going out and having some outdoor activities, please watch out for what has been kept in your mouth or where the food has been kept and how hygienic the conditions are. Dr. Nair is not refraining you from having fun, but being very careful when this condition is there. Thank you so much, Dr. Nair, for today's episode. It's such an informative episode that I have not known about it before, but today understood in complete detail. Glossitis, a condition of this tongue where there is swelling and there's lack of sensation and also lots of pain. Friends, if you like this episode, and I'm sure you do because we do know that you watch this episode, please like, share, and subscribe. And when you subscribe, every new episode will give you an indication that the new video is up. Until the next episode, please take care of yourself. And for all the other information, it is shantigram.com. The number is on your screen. Thank you so much, Dr. Nair.
Thank you so much.